I need to talk today about a topic that is fairly common called leaky gut, but that's not really the name of it. It's called permeable membrane, but there are steps to evaluate and to address a leaky gut. First of all, we got to make sure what the cause of it is. And some people can have an infection, some people can have a medication. Who knew? Some people, maybe it's your food that you eat, maybe it's even the supplement that you're taking that's driving your leaky gut. Of course, you could have concussions, you could have other illness, you could have pneumonia that drives it or even let's say chronic asthma or COPD or blood pressure that's too high or too low or blood sugar that's too high or too low. These things are causes, and most of the time it's multifactorial, meaning there's more than one issue that's causing a leaky gut. You can even have an autoimmunity that's running it. And then, finding out again what's not only causing it, but what is an inflammatory response that goes to it. Now, in the leaky gut world or permeable membrane, there's actually four types. So some people might have a type that takes clinically up to 3 years to heal, and somebody else might have 6 months. But let's say you went somewhere and you went to doctor, and nobody was able to test you and find out which one you had. And maybe you felt better from time to time, but you had the one that was like 3 years long, and all you've ever done something consistently was like 4 to 6 months. All right, so you feel better, but did it ever get a chance to heal? So you might be going from doctor to doctor because they haven't been able to find out what's going on. What if you have a trigger that's going on there that isn't being dealt with? Now, I know a lot of doctors, especially in the alternative medicine, okay, you got to fix the gut, got to fix the gut, the gut's what's running it. But when we do a history in our office, it's trying to find where was our trigger, where was our trigger, where was our trigger, where was our trigger? Did they go on a mission, and maybe they drank some water, and or did they get like, well, even currently, maybe in the last 3 years they had a particular vaccine or infection that was kind of worldwide that came through there, and their body just didn't handle it well. And so they maybe had what's called dysautonomia or POTS, and then they ended up with mast cell activation syndrome. And then all this inflammatory response broke things down, or they had a combination. We had a young man that went into a fraternity, and the fraternity was just absolutely full of mold, and he just happened to be, because he's not sleeping at the time. Now he's got Epstein-Barr that's reactivated, and then the mold came in and did some other things, and now he's got dysautonomia on top of it, and it really is a bad situation. And so this leaky gut is going, and how bad is it? Well, because of his age, his youth is saving him. But a lot of people have these things, or they're doing things, or they're taking, let's say, a probiotic or whatnot, and they're trying to get ahead on it, but it's not really repairing because there's many other things that are at work. So if their digestive system isn't working, if their gallbladder isn't working, and really doesn't matter what you're taking nutritionally, medication from a medication or nutrient, it doesn't get broken down. So how do you have the right products to repair a leaking gut? I mean, we got to find out that what's going on. We have to make sure that it can get there. We need to put out the fire that it's there, and we need to be able to break down that nutrient or supplement or even medication so that it goes there and does things. And this is where, it's important to have good bacteria and prebiotics, but taking a bacteria or a probiotic for a leaky gut is not very welcomed in the literature that it's going to heal somebody. Can it make you feel better? I'm not questioning that. Yeah, sure, it can. But is it going to heal it? Now, you can take that for way more than 3 years and you still don't have it because you haven't, that's not necessarily the trigger that's going on. Like, for instance, let's say you did have E. coli and you give a probiotic that goes after, is it going to get rid of all the E. coli and the infectious side of it? No. But can it replace some things? Yeah, it can. So we want to find out what is causing what's going and what we can do to repair it. Now, again, there's four types of leaky guts. Four. One of them 6 months, and one of them is up to 3 years. And I'm going to actually put my fingers. This is what I do in the office. Okay, so inside of the intestines, you have these little holes between my fingers, and that's what your nutrients, your supplements, whether it's protein, fats, carbohydrates, get through there, and they get to the tissue and repair. Oxygen, sodium, calcium, minerals, all those things. And then we get swelling that comes through there. And now we have the potential, it's called a permeable membrane, and now it's called paracellular. And now we have food particles and other things that can get out there. And that can take 6 to 9 months to heal. And then you have things that actually come and destroy it. So let's say you had a salmonella infection. Let's say you had an E. coli infection. Let's say you have ulcerative colitis, Crohn's, celiac, Whipple's disease. These things destroy. It's a different particle. It's called actomycin. And now could be 12 to 18 months to heal. Well, what if you had normal bacteria inside of your intestines that got out? And now it's in the bloodstream. Well, that's called lipopolysaccharide, which is in literally every clinical disease, heart disease, cancers, Alzheimer's, Parkinson's, dementia. Well, you take the first one that spread it apart, and now that's almost 2 years to heal, and now this one falls apart, and now it's up to 3 years to heal. So understanding what you're at now, hopefully you feel better in like a few months because there's been some changes that go along, but you got to know what you're doing as far as how long you have to continue something, because if you step away from it, all that work you've put in and trying to manage, well, I don't want to have this trigger and that trigger and do this and do that, are for naught. And so I just want to make sure that if you're being treated for leaky gut, you at least know, and your doctor and whoever you're working with is helping you with that. And if not, we do that. And one more thing that comes along with this is that people are having trouble eating, dysphagia, or they get gastroparesis and it's not digestion, it's going through there. And if they get that with constipation and a diagnosis of irritable bowel syndrome, these are big deals. And sometimes you can get irritable bowel and you don't have like constipation, diarrhea, or all. It's just maybe the side of it is constipation, but it still falls into the irritable bowel. By the way, that's a huge risk for Parkinson's, and that's not good. And so these things that lead into your intestines, leaky gut, then leak out into the body, and they have a propensity to eventually start to hit neurological parts of the brain, especially the blood-brain barrier, break these things up. So if you've ever heard of beta amyloid plaques or tau proteins that come, and alpha synapsin that are in these long-term neurological issues such as Lewy body dementia, Alzheimer's, Parkinson's, they come from the gut for the most part. So making sure that that's in check, and not just doing, okay, I'm doing this leaky gut protocol, or I'm doing let's say a colon cleanse, or I'm doing a parasite cleanse, or the candida stuff. Today, with the information that's out there and what we know, it's not enough. It's not enough. And we can do more. And it's not like, okay, you're going to spend thousands of dollars more to do more. It's just making sure that you don't have this, and this trigger that's going along there that perpetuates these things. I'm Dr. Alan Trites. Be well.